In this section, we'll learn about the inhaler you have been prescribed and how to use it. Most medicines for COPD come in an inhaler. You use the inhaler to breathe the medicine into your lungs. The COPD medicine you have been prescribed is delivered through the Respimat inhaler, which may be different from other inhalers you have used in the past. In this section, you will learn all about the Respimat inhaler. We'll take you through what the Respimat inhaler is and how it works. We will then watch an instructional video on how to use it correctly. Every inhaler takes some time to learn how to use it at first. But after your first few times using your Respimat inhaler, I'm confident you'll get the hang of it. How to use your Respimat inhaler. If you're watching this program, you're probably looking for information about how to use your Respimat inhaler. The following video is about 2.5 minutes long. We will show you how to prepare your Respimat inhaler for the first time use and how to use it every day. Afterward, we'll talk more about some features of the Respimat inhaler.
Let's begin by learning how to prepare your Respimat inhaler for first-time use. You'll need to do this whenever you get a new prescription, about once a month. Keeping the cap closed, press the safety catch while you firmly pull off the clear base. You should write the discard by date on the label, which is 3 months from the day you insert the cartridge. Next, take the cartridge and push the narrow end into the inhaler. Place the inhaler on a hard surface and push down firmly until it clicks. When it's properly in place, a little bit of the cartridge will be visible, about 1/8 of an inch. Next, put the clear base back into place until you hear a click. Do not remove the clear base again. With the cap still closed, turn the clear base in one continuous movement, a half turn in the direction of the arrows, until you hear a click. Now, open the cap. Point the inhaler at the ground and press the dose release button, then close the cap. Repeat these steps until you see a spray of mist. Once you've seen the mist, repeat these steps 3 more times. This will ensure your inhaler is ready to use. Don't worry, it isn't wasteful. Your inhaler will still have all of your prescribed doses. That's all there is to preparing your Respimat inhaler. You're now ready to use it daily. Be sure to follow your doctor's instructions about how many puffs you need daily. For complete details, look at the instructions enclosed with your prescription. With the cap closed, begin by turning the clear base in one continuous movement, a half turn in the direction of the arrows, until it clicks. Now, open the cap. Breathe out slowly and fully. Close your mouth around the mouthpiece without covering the air vents on the sides. As you take a slow, deep breath, press the dose release button and inhale the mist. Hold it in for 10 seconds, or for as long as it's comfortable. Now, close the cap. Your doctor will tell you how many times to repeat these steps for the correct dosage. A simple way to remember how to take your Respimat inhaler is TOP, or top. T is for turning the clear base. O is for opening the cap and closing your mouth around the mouthpiece. P is for pressing the dose release button and inhaling the mist. So when you think Respimat inhaler, think turn, open, press, top. For complete details, look at the instructions enclosed with your prescription. And remember, your doctor will tell you how often to use your inhaler and how many puffs you need to take daily.
I hope this information was helpful. If you have any questions, write them down and bring them to your next office visit. And if you can't make it to us, your pharmacist can also be a big help. Ask him or her to show you how to use your Respimat inhaler when you pick up your prescription. Or try to do it yourself at the pharmacy and have the pharmacist watch. The medicine cartridge in your Respimat inhaler lasts all month. Do not reuse the Respimat inhaler or use it with any other medicine than the one prescribed with it. Be sure to follow instructions about how many puffs you need to take. You can find written instructions enclosed with your prescription, and you can watch this program again as many times as you need until you're comfortable using your Respimat inhaler. Remember, it's important to take your medicine every day. I hope you'll have a good experience with your Respimat inhaler. As always, let someone at our office know if you have any questions. We're here for you.